Hi, I'm Dr. Paul, and I wanted to talk to you today about my do nothing treatment. And I explain this to all my patients because sometimes it feels like I'm doing nothing, but it has a profound effect even though it's a gentle treatment. I do firm treatments too. In chiropractic, sometimes you get pops, but I'm doing less and less of that and more of the gentle treatments now because it's safer. Even though chiropractic is very safe no matter what technique you use, I like doing the gentle treatments because there's certain areas that you're not going to get a pop with, like for example the head. I am big on finding the root of the problem, and I know everyone says that, but when someone comes in here, they have some kind of symptom. My job is to figure out where it's coming from. I find that the symptom is just an end of the beginning. The beginning is the root cause, the end is where it's showing up. If you have a problem in one location, it does not mean, in fact, 50% of the time, it's coming from somewhere else. Now, if you have a local injury, that's a whole different situation. So let me tell you my philosophy, because I want to show you before I start treating you, if you're a patient in my office, why I do what I do and why I do it. And so the cranium is a critical area that I start with because I'll just show you one article here from this book by Dr. Norman Deutsch. He wrote a book called The Brain's Way of Healing, Remarkable Discoveries and Recoveries from the Frontiers of Neuroplasticity. It's a big, long statement. It's basically say that one of the remarkable discoveries that he has discovered is a thing called matrix repatterning for traumatic brain injuries. I've been doing this for, 15 years now, and I am very, very, very grateful for learning this technique. It took me a long time to learn pressure points on the head, and I'm finding profound changes if the head is involved. And I'll start off with myself. When I was 18, I was playing a video game in Santa Ana, California, playing in front of the TV on New Year's Eve. I was playing and 12 o'clock hit. The policemen, I found this out later, all go underneath the freeway for one reason and one reason only: to protect themselves from people shooting off guns. You know where I'm going. I was playing and suddenly, boom, I went down like this because I felt like a huge rock hit my head. I felt my head, I looked at my fingers, and there was blood. I looked on the ceiling and there was a big hole. So a bullet, a .45 Magnum, went through the ceiling and I made the paper. The paramedics came, the police came, and they said I was okay because they found the bullet outside me, and I was grateful for that. But that began my journey of cranial problems that I already had and I had a history of allergies I was born with, and now this environmental factor made my allergies worse, and I was miserable. I would use a half a Kleenex box in one day for leaking during especially fall and spring seasons. Very seasonal allergies, dust allergies, cat allergies, and cat allergies were the worst. Now there's multiple components in allergies, but I would say that today at 55, I'm grateful that I learned cranial technique because I've been able to help myself and many patients. I'll tell you one more story. Many people that have come to get cranial treatment, they refer patients. You know why? Because some of those patients, after the first treatment, if they've had a lot of inflammation in the head, the treatments from the matrix repatterning for the head releases all the tension in the head, all the inflammation, all the pressure on the brain. What does that do? Multiple different symptoms, from the head symptoms all the way down, because the brain affects the rest of the body. These people felt euphoria. One person had a great intimacy with their significant other that night. Some of them have great energy for 2 or 3 days afterwards. And like I said, euphoria is felt sometimes on these patients because there's a release of tension that's in the head. A tourniquet on the brain is not good. So that's how I discovered cranial treatment. Now, let me just go over with you about what that is and how that works, because it's so gentle. I always feel for a lack of motion. Okay, so what is that? What's lack of motion? Well, they found through meridians that there's all these lines of energy that go on the body, okay, from head to toe. These lines of energy that represents different organs and different pathways that go right through the head. And these lines of energy need to be released because there's like short circuits in certain parts of these lines of energy, or we call them fields. And when there's a short circuit, they're showing through through this article here from the NCBI, which is a government medical site, is they're showing that electrical impedance of acupuncture meridians, because of these collagenous bands, which basically are inflammatory scars. That's the way I look at it. From old injuries. It could be from old falls or whiplashes or hits on the head, football injuries, you name it. You know, from even, there's a lot of different injuries, like me being hit on the head from a bullet. Cause these collagenous bands and cause these myriad of symptoms, like post-traumatic stress disorder can be resulting from it. And so my job is to find those collagenous bands, basically. Figure out where the root collagenous inflammation scar is and treat it. Now, how do I treat it? I use my fingers, I use different instruments, but let me tell you what it does and why it works. For example, here, Dr. Warren Hammer, a chiropractor, found that this treatment with the hands causes a piezoelectric effect. Okay, basically when I touch the body, which is the body is made up of these crystalline arrangements, and all living tissue has this. When I touch these crystalline parts of the body, and I put pressure on that area, whether it be gentle or firm, it creates a piezoelectric effect. So there's actually an electrical input. And so what I'm finding is, when I'm getting the results, is I feel it before and I feel it after with my palpation skills, and I'm finding a release in the tightness of these bands. And that's where I get the results. Now, my job, the most difficult part, is finding out the source and the root of where it is. So I have to take a good, thorough history, and based on that, I treat and I record my results, and I get really good results because I'm getting to the root of the problem. So that's basically, in a nutshell, of what I do. Now, this piezoelectric effect is just gentle pressure, and I use certain instruments that help me. One of the instruments is a percussor like this. I mean, you can get it used for $1,000. I bought mine for more because it's not used. Sometimes I use a laser, and this laser, you know, actually costs more than $40,000 brand new, and now you can get it used for this amount. And so I can use that as well. This penetrates deeply into the tissue to create healing, as well to the scar tissue again. And this is a note from that doctor that we talked about. I think I showed this to you, where he, basically, yeah, I showed you this book here, and this is from that book. And he basically says this about matrix repatterning. This procedure can be very helpful for some people with traumatic brain injury and other head injuries, even as a first intervention. I always go to the head, from above, down, inside, out, meaning that it starts in the brain. It's been given from above, and God has given us this electrical input from our brain. Our brain controls everything else, and it comes out. The brain directs the activity of everything else. And so, as a first intervention, I encourage anybody that's been not only traumatic brain injury, but any injury. And it's not a do-nothing treatment, because I'm finding these patients are getting results and getting good fruit. So, until the next visit, I look forward to seeing you. I'm Dr. Paul of the Body Intelligence Center.